How many patients do we have outside Tankatanga? A lot of them are roaming, and they have families.
Yes.
And then, it has failed in developed countries, concentrating on high-class psychiatric hospital. It has failed. The world is now changing. Along with WHO recommends that we need to do a lot at the community base. That's why I say the pyramid.
Yes.
Do very little. We need people, of course, patients with acute psychosis or acute mental health problems will be there. We need them. They will be sort of hospitalized. But what is important is to do a lot at the community level, at individual level, involving those with this condition, creating the necessary supportive environment, and again, looking broader to tackle the determinants of mental health. Mental health is not only the mental health, diseases, but we need to look at other factors that contribute to mental well-being. And this is the economic, the social, the environmental, all these things need to be tackled.
Okay, they're all a part of it. Okay, over to you again, Mr. Baba. Have you seen an increase in the number of patients at the clinic since you've been there?
Yes, I would say yes to the question.
Okay.
Because when you look at, as he has rightly said, well, community has a very big role to play. And when you look at it, as been said, the statistics given, when you look at it, the ages of those, affected is ranges from 15 to 50. So you realize that definitely, youths are more or less, involved in it. Due to some of the substances, that are presently available in the country here, that's definitely, has, increased the number of admission at the hospital. And then the other thing might also be, how will I call it again? The adherence to the treatment. Sometimes, patients might take the treatment, and then so after some time, they will stop everything, and then because they will think that they're very much okay. So that will also cause relapse. At the end of the day, patients have to be brought back again. And then with that, as I said earlier, the substances that are also available in town now also start increasing the number of admission at the hospital. In the case of the drug-induced psychosis, has definitely increased the number of admission.
Okay, so how would you describe the conditions, the clinic conditions for the workers and patients at Tanka, most frankly?
I would say because the government is definitely trying to do its own quota, and has been rightly said, earlier, definitely, they making their own part, or they doing their own part. But when they alone cannot do everything.
That's true.
So see, at the end, we need other people from outside to also give an helping hand. When I say outside, I'm referring to other, NGOs and then stakeholders, who also need to come into play, because it's not a one-man show. Every individual has a role to play.
Yes.
But the condition at the hospital, I would say, it's comfortable. I would say, because patients, the treatments are available for the hospital. Though our outpatient, the tracking team has not been going for some time now due to a reason or two. But for the hospital, as of now, though we might not say, the way we want it to be, that's how it is exactly. But as of now, we'll say that, some are available that will be able to keep the patients within the hospital. Likewise, that of the condition of the staff too. Though we need few things to be into place, like maybe the transportation of the staff, because sometimes they very much find it difficult to transport themselves all the way from the highway or from home to the working place. That's another issue, that's a burden on the staff of the hospital.
Yes.
So if some of those things are addressed, it will very much make the environment very conducive for both the patients and then the staff. Because staff who has worked that distance, been exhausted already, it will be very difficult for the individual to deliver service expected from him or her.
Yes, you just mentioned it, but I'd really appreciate it if you made it clearer. What did you say is the age bracket that is mostly affected?
15 to 60.
15 to 60. All right, thank you, sir. Over to you again, Mr. Momadou. What has been the WHO's biggest challenge in tackling the issue locally in the Gambia and globally, worldwide?
Well, I will say it's everywhere. The situation is that WHO is mandated to coordinate international health. And of course, WHO is not implementing. I think that has to be made. It's not like imposing. It's not a supranational organization. It is an intergovernmental organization. It's the government that set up WHO. So it is not like parachuting on government to do what they tell them what they should do or what they should do this by force. No. WHO's capacity is to give the technical leadership, the advice necessary based on evidence for them to improve their mental health situations. Now, it is a challenge, of course, resources are very limited. Like I said before, the world is spending less than $3 per person per year on mental health. And this is very serious. In fact, in developing countries, it's 0.025, 0.25, $0.25 is spent on a person. We don't have psychiatrists. What the WHO is saying in 2011, the population ratio, 100,000, for every 100,000 people, there is only 1.27 psychiatrists, the whole world. And if the psychiatric nurses is about only 10. This is serious. So we lack the resources. The WHO is saying now, What countries can do is to make sure that they are very responsive to mental health, make sure that the budget, the financial arrangements are in place. WHO is there to give the technical leadership. Training is our capacity to build the capacity of health systems to better address mental health by training.
Yes.
Training doctors, training public health experts, training mental health professionals. This is our job, and then we will continue to do that. But again, it's a big challenge. As I said, WHO is not an implementing organization. It's the governments that do it. So the challenge is not much attention is paid to mental health. Yes. That's the biggest challenge. The world is very, very sort of supine as far as where mental health is concerned. We are not doing enough to react as we are doing with other diseases. So for WHO, the biggest challenge is definitely the capacity in the country is limited, and in terms of human resources, material resources, financial resources, they are limited. These are the burning issues. But WHO, as I said, in the 2013 to 2020 action plan, is ready to support countries to strengthen their mental health systems based on evidence, what can be done, what has been tested. You know, there are the drugs available, the human resources needed. All these things are there within the health system. So WHO is going to really assist countries in strengthening their health systems to better address mental health issues.
Yes, sir. Thank you very much. Okay, Mr. Baba, as a last question, how would you describe the severity of mentally disturbed people on the streets in the Gambia today, dating back to the last 4 years? How has it been? Has it been more or less? With the help of the organization.
Despite the fact that I'm a new person in the health system, but I will realize that, I would say, it is increasing. Because me rightly said, when you look at it, less attention is paid to mental health in the whole world. And the Gambia is not an exception. Because even when you look at the Minister of Health, they're giving less attention to the mental health. So that would show that definitely, attention given to the mental ill people is very much limited. Obviously, you expect that to increase the number of patients on the street. And then the other thing also is the family contribution or the societal contribution. Society will contribute less or no attention to the mental ill. You have here somebody who is admitted at that place, at the individual is dumped there. You call the individual, the family will tell, well, we don't know, the guys that you're talking about. The guys, is admitted, you decide the person, nobody want to contribute to the affairs of individual. So at the end of the usual, it's a problem with us, at the hospital. This is why you have the increase of number of patients on the street.
Yes, thank you very, very much, sirs, for being here. You're watching the Fatty Show. Too bad we've come to the end of it. This is the saddest part for me. But as recap, we had Miss Maimuna Jallo, who happens to be the CEO of Vogue, House of Fab, and New Fashion Boutique, and also representatives from the WHO, Tanka, and also the Medical Health Unit. It was a splendid show overall. And until we come your way next week, it's a tata from the entire Fatty Show team. Thanks for having us. And yeah, thanks for being here, sirs. Thanks a lot.
You free credit without spending a budu. Wow. Call us Kumium.
What's up, girl? Did you hear the greatest offer from Kumium? Kumium? They always come in great ways. Tell me about it. You can receive free credit without spending a butut. Oh, come on now. For real. Every minute of international call you receive, Kumium will give you $3 access.
Call us Kumium.
Also, every minute of cross-net call you receive, you will get $1.
All I have to do is ask all my friends at home and abroad to call me on my Kumium line.
You know you can use the same credit to call, text, and browse the internet. Wow. Call us Kumium K. Call us Kumium.
Call us Kumium Y. Kumium. We are better together.